Welcome back. At least 500,000 sub-Saharan Africans die of cancer every year. 500,000. International SOS says there's been a 45% increase in deaths in the region in the last 23 years. That's since the year 2000. Now, breast cancer is the biggest contributor. Today is World Cancer Day, and we focus on awareness and education. So let's discuss this with Dr. Chris van Straten from the International SOS. A very good morning to you, Doc, and thank you so much for your time. A 45% increase since the new millennium began. What are the factors, and how are we going to be able to stop this, or at least stem these kinds of numbers?
Good morning, and thanks so much for inviting me to talk and present. It's a sad number to see, and there are many factors involved, especially in the African continent. Some of it has to do with an aging population, and elements such as lifestyle, changing habits, the way people are eating, lack of exercise. Some of it also speaks to elements in terms of screening, so education, screening, and certain vaccinations that can prevent certain cancers, and there a very good example is HPV. So it is concerning. But I also want to give a word of optimism. It's amazing how much medicine and science has changed and evolved. And we just look at the COVID pandemic and the medicines we've had. So it is concerning. There was a Lancet paper May of last year. The WHO has commented on that and laid out plans for Africa and steps that we all can and should take. Thanks very much.
Doc, the difficulties of combating cancer when you have an ailing health system like what South Africa is experiencing at the moment, especially more ailing now following the COVID-19 pandemic, the focus on that, how it literally just brought the health system to the knees. How difficult does it become to combat one of the biggest killers in the world?
Yeah, great question and a big challenge. So certainly before the pandemic, there's many conditions, and I'm going to include there tuberculosis and certain types of cancers. We've, in the medical community, felt that we were winning. The numbers were showing a plateauing, or we were winning. And then during the pandemic, resources had to be channeled to fighting the pandemic. We also saw people resistant to going for their regular screening or follow-ups. And yes, we've seen a spike, particularly in certain cancers. So what we're doing right now is so important. We're communicating, we're getting the word out there, and especially in the workplace. That's where I've been involved with several companies to drive education programs in the workplace, where every day you can make a difference. How you eat, how you exercise, and getting the screening done is so important.
You bring in an important point here where you talk about employers and what companies can do for, you know, their staff. You know, you're suggesting one of the things could just be try provide a better working environment. You know, we are a stressed human being. You know, there's so many worries we're going through, both at work and, you know, in our personal spaces. So what then can, for example, an ENCA do for a Morena and a Faith in helping us just lower those stresses that we have? Because to an extent, cancer is a lifestyle disease. So if perhaps you can help deal with the lifestyle, help deal with work stresses, that could play somewhat of a major role, no?
Certainly could. So what we've seen, and it's been exciting to work with big companies in Africa and abroad on exactly that topic. So first off, it's that education, getting people engaged, spreading meaningful information, not just a once-off session, doing it repeatedly, making part of the culture, open communication. And then it's interesting, a colleague recently said, you know, sitting's the new smoking. And in a way it is, right? And I'm guilty. I spend my whole day in front of a screen looking at numbers. Well, I need to change that, and I can change that. And many workplaces are incorporating time and exercise, whether it's 10,000 steps or a gym close by or walking around the block. We started doing that in our community. And then what's available in the canteen? What are you eating? What we eat plays a significant role. Highly processed foods are linked to different types of cancer, like colon cancer. And then I must add in this, and this is something I've been working with for several years with the big companies in South Africa and other parts of Africa. I don't know if people realize this, but some cancers are completely preventable through vaccination. HPV, human papilloma virus, it's one of the most commonly transmitted sexual diseases, is the main cause of cervical cancer in women and African women. And countries where the vaccination rates are high we're seeing the cancer rates dropping. Japan is a great example of that. So in the workplace, and there are companies that have realized this is a major concern. Their staff are sick. Their staff are not as productive, and we can support them in the education and the vaccine drives to prevent that form of cancer. Great question.
Doc, just before I let you go, they say when you know better, you do better. But we've come to also see that even those who do know better still don't do better. And I want to labor on that lifestyle aspect, yep. The lifestyle aspect of treating cancer. There are those that know that they shouldn't be drinking what they're drinking, or at least in copious amounts. Smoking, like chain smoking that happens, processed foods, and they say processed foods are the nicest, so why would I want to go and eat celery sticks? But it's that what I mean by when you know better, you're supposed to be doing better. What about the element of fear, though? So I do know better, I do know what I should be doing better, but I'm not doing it because I am afraid of finding out what I could be dealing with.
Great question. I love the way you framed it. So, by the way, I'm guilty, right? So I smoked for many years. I studied music before studying medicine, and I felt cool. It made me feel good. I smoked to ease my own stress. And it was when I was studying medicine that I realized, hang on, this really isn't a great idea. And by the way, I didn't just quit once. I probably quit 10 times over about 18 months. Now, I haven't touched a cigarette in over 10 years. But it took a lot of effort, and it took support from other people. You touched on another element, and that was stress. I think everyone has experienced considerable stress because of COVID, the pandemic, the impact on work, etc., etc. And one of the things that I do encourage is mental health support. There's so much that can be done to support people in the challenges, the stresses you face, and how does one get fit and healthy? A once-off talk doesn't cut it.
Yeah.
You need that constant support. You're absolutely right with that. Thanks so much.
One of the best things about the position you and I hold, where I'm a broadcaster and you're a medical professional, is that we can bring in that element of relatability. So it's important that someone like a Dr. Chris van Straten is able to come out here and say that, you know what, I've been 10 years clean. I himself knew better, but I wasn't doing any better. And I myself, as somebody who shares this information as a broadcaster, also knew better, but I wasn't doing better. So congratulations on being 10 years clean. I'm 2 years clean from smoking cigarettes. So
good job. Keep going.
Hopefully we can get more people just like you and me. But Dr. Chris, we're going to leave it there for now. Thank you so much for joining us here on ENCA. That is Dr. Chris van Straten from the International SOS.